Once again, it's Monday night, time for the Fab Four. It's a different version of Fab Four because actually what we have are Fab Three and somebody who goes to the doctor. There's Dr. Larry Bookman, Dr. Patrick McGough, Oklahoma City County Health Department, and Dr. Chansom, Dr. David Chansom, who was bragging upon Dr. Patrick McGough about what Oklahoma City County has done in terms of getting folks vaccinated. We even gave a round of applause last week on this show. Yeah, exactly. That's what we did. So let me make sure I got everybody unmuted here. So it's good to have you with us, Dr. McGough. And half of the Fab Four are doing fabulous other things.
That's good. It's great to be here, Scott, and I appreciate all of you and your program. And I did get to watch some of it last week, and I do from time to time. I really appreciate the good information, the accurate information that you guys are trying to share.
It's kind of fun. And by the way, we have this thing that we're started doing now because he's so good to the program, and that is our friend COVID-19 in Oklahoma on Twitter. We've got some other friends like Doug Carroll and like guys that are retweeting our information, and Jimmy Branch, people who log on here and then send us messages and questions. But I'm going to turn this into a tradition and always make sure that COVID-19 in Oklahoma, who tweets out all this great information from parts unknown. I think I know where he's at, but we're not just quite sure just yet. But he's like Batman. So by the way, did you guys see that the 60 Minutes that Michael Keaton is reprising his Batman role?
I thought he was great.
40 years later, he's going to be Batman. And
he's going to do another role too. Did you see that?
I did.
On the opiate problem.
So. Yeah, Dope Sick. It's a series. By the way, he said he tried to, they asked him, did you put the old Batman uniform on? He said, yes, and it fit. And he goes, it fit just like it did 41 years ago. Okay, Dr. Bookman, take her away.
Well, what I'd like to do this evening for everybody is we've got all kinds of information now on boosters and children, and I'd like to try to make it so that everybody understands. We talked last week about the boosters for adults, but there still seems to be confusion. I had multiple questions. I'm sure Dr. Chansom has. So, David, I'm going to call on you. Try to synthesize the adults. Just stick to the adults with the three boosters. Who's supposed to get it? Which one are they supposed to get? What does mix and match mean? And try to make it so that everybody finds it simple.
Okay. No pressure here. Okay, so we've all been following the booster issues. At first, it came out that you could get it if you were immunocompromised, but severely immunocompromised, because all the data came out of the transplant population. Then it kind of went on from there. You had some drama where the FDA didn't, or the FDA advisory panel did not entirely agree or entirely, I don't know what the right word is, recommend what the CDC implemented. But essentially what it is now is we've been saying for a while, if you're 65, let's take the low-hanging fruit first, okay? 65 or over, you probably need a booster 6 months after your second dose if you had Pfizer or Moderna. We'll talk about those two first. If you had Pfizer or Moderna 6 months after your second dose, you'd be eligible for a booster. People who are under the age of 65, at first they kind of said, and I think they may have changed this a little bit. Dr. McGough, you might feel free to correct me anytime. But at first they said if from 50 to 64, it was recommended with certain medical conditions. If you were 18 to 50, you could think about it, is the way they said it at first. But then it kind of changed. And then there was the question of whether or not people who were occupational exposures, not necessarily what we call host characteristics, but rather occupational characteristics should be. So that would be like nurses and doctors and respiratory therapists and folks who are on the front lines, or people, who were kind of in those first lines of vaccinees that we had, like restaurant workers, people that were in customer-facing endeavors. Now what it is it's essentially anybody with 18 to 64, so 65 and over, everybody needs a booster. 18 to 64 with certain medical conditions that put you at a higher risk of developing severe COVID-19. diabetes, BMI greater than 30. If you're on an immunosuppressive medicine, maybe you have rheumatoid arthritis or one of Dr. Putman's Crohn's patients or something like that who's on an immunosuppressive agent. Maybe you take high-dose steroids because you're a terrible asthmatic. If you have a chronic heart condition, or if you have a chronic lung condition, if you have chronic kidney disease, these are all things that put you at risk for developing severe COVID-19. So it is recommended that you get a booster shot. For people who are 18 to 64 years old who have occupational exposure, and that can be just about anybody. I mean, essentially, people who are frequently in contact with other people, again, your restaurant workers, maybe the people who are working the Thunder venues, people who, as societies continue to open up, security guards, police officers, first responders, just about anybody is eligible for a booster. You can mix and match now. So it's not necessarily recommended that you do, but at the very beginning, when they first recommended boosters in the immunocompromised population, they had recommended that you stay in class. If you had Pfizer 1 and 2, they wanted you to get Pfizer 3. If you had Moderna 1 and 2, you want to get Moderna 3. Now, listen, I'm not going to pretend like it was a perfect system even during the first 2 shots. Yes, occasionally someone got in the wrong line and ended up with a Pfizer shot or a Moderna shot. Does it make that big a difference? Not really. They both code for the same glycoprotein, maybe just in a slightly different way and in a slightly different package, but they're both going to the same destination. And then I thought really the biggest news, what we've been waiting for a long time, was what do we do with Johnson & Johnson? And that was something that kind of, in my opinion, kind of got lost in the shuffle a little bit, was all these people who had the single Johnson & Johnson shots. I can't tell you how many people came to my clinic and said, I got a Johnson & Johnson, but I really think I want a Pfizer or something like that. Well, I can't do that. Now I can tell them that I can. There's some data that looks like if you had a single Johnson & Johnson and you go and get a Pfizer or Moderna booster, you're going to have a more robust response even than if you had the Johnson & Johnson. Let's remember, those are a different technology. One's a DNA, one's a messenger RNA. So it is a little bit different. And maybe the mixing and matching is good. Maybe it isn't. I don't know. There has been some data out there that shows that Moderna may be a slightly more effective vaccine in terms of sustained antibody levels. It is a higher dose than the Pfizer vaccine was. So I think there'll be a lot of data that comes out as this continues to roll on, and we get some retrospection, kind of see what's happening there. So. Was that simple enough, Larry? I thought it was horrible.
I think that's pretty simple, but let me add a few things. With Johnson & Johnson, unlike the others, it's recommended 2 months after your single shot, and it's for 18 and above. Everybody,
any reason,
is to get the second shot. I'm not going to call it a booster, a second shot. You know, and whether it's a Pfizer, Moderna, or another J&J, it doesn't matter. But I think people need to know the studies that were done on mixing and matching were very small, 50 patients each in each arm. That's ridiculously small, but they wanted to get it out with all this other information. And I think that what's important for people to understand, it's not that Moderna is better than Pfizer or Pfizer is better than J&J. They're all still good, and it doesn't matter which one of the boosters, as long as you get your second or third shot, that you get your booster shot. And the importance also is for clinicians like Dr. Chansom and others, you don't have to carry all 3 now. You can just have one, which makes it much simpler. You know, pharmacies could only maybe have one. And you don't need to go in and specifically ask for Moderna or specifically ask for Pfizer. You can get whichever one they have, and you're going to be fine. The numbers may be slightly different, but we're talking about slightly different numbers, not clinical significance. And so I think the important fact is get a booster. If you had J&J 2 months, get a second shot. Don't worry about which one. If you have a preference, find the one you want. They're all over the city right now. But get a booster.
And Dr. Bookman, I think you made a really good point. They're all over the city. You know, I try not to go to certain stores, grocery stores in general, but I was at one on Sunday, and they announced several times while I was in there, you can get your COVID vaccine, you can get your flu shot. I mean, it's wonderful that it really is. I've been saying for a while, it's flowing in the streets. I really feel like vaccine is readily available, and this made it even more so. And I think when you were talking about the Janssen or the J&J, it is important to realize it is just 2 months, and basically everyone that's 18 and older can get any of the three. So that group is really, really simple for them to understand what they need to do. And I think it's important that J&J did that. In particular, my youngest brother was in the hospital after having J&J, just one dose. And he had COVID, and he was severely ill. He was in intensive care. And a lot of people were making the comment like, well, what good did that do him? It saved his life. That's what good it did.
That's a fact.
Because he came very near to death.
Mhm.
He has a number of comorbidities, including diabetes, his cardiovascular disease, hypertension, extreme hypertension. And like most of us that are over 50, he's also overweight. And so I think for him, it was a lifesaver, that one dose. But thank God now he can go get any of these three and, carry on, as long as it's been 2 months since the last one. So I think that is one of the biggest strides that we've actually made. I'm very thankful. And Dr. Chancellor, you did a great job explaining, and couldn't have said it better myself. And I was reading the chart as you went through it and you hit them all. Great job. And so I think, that is a little bit more challenging because folks have to remember it is 6 months, but it's really 18 to 65 or to 64, whatever the circumstance. There's one that you will fall in, I'm quite certain, unless your life just has no risk at all.
That's not Oklahoma.
There's very few people who wouldn't qualify. Very, very
right. And like you said, Dr. Bookman, unless you lived outside of Oklahoma, because we're still in a high transmission rate. And so that in itself makes us in a high risk setting. So we qualify 18 and older, go get one of these three somewhere. If it's been 6 months since your last one.
No,
and I think that's really good.
I think you made a great point there, Larry. It'll make, as a provider of vaccines, it makes our lives a lot easier. There's nothing we hate more than throwing out a half-used bottle of Moderna or Pfizer or something like that. And if I can just draw one of those up a day, and then, because if you're looking at boosters now for Moderna, a single vial of Moderna is 30 boosters.
Mm-hmm. Mm-hmm.
It's tough to find 30 people that want to come in on that day. Now, we've had some days where we've been able to do that, and then we'll kind of run around the building and say, hey, who wants a shot? And, if you stand still long enough, we'll give you one. But it makes logistically, I think we all breathed a sigh of relief when we saw that come through, because it helps quite a bit on the pharmacy side of it.
Mm-hmm.
And Dr. McGaw, what can we expect from Oklahoma City County? What plans do they have to try to get these boosters for adults? Let's stick to adults before we get to the kids.
Mm-hmm.
But to get it to, obviously, some of the reticent population, some of our minorities, some of our poor, some of our rural. How are we going to get these out to the county? Because you've done a great job. We said last week, over 80% have had at least one shot. Mm-hmm. That's outstanding. So now how are we going to get the boosters to them?
Right. And largely it's the same way. And I think one of the pieces here that is so amazing is that it's so readily available. And so people don't have to be so concerned about, where they're going, what they're doing. But 5 days a week, we're offering from 8 to 4 at all three of our clinics. So our north location, south location, and what we call our west location. All of those are offering any of these three vaccines. So people can come by for those. And then also we're having some special things that are going on. Passport Health, as you guys may know, but starting tomorrow, they're going to use our brand new drive-through here at the north location. And so on Tuesday and Thursday, they'll be giving shots from 2 to 7. And on Wednesday and Friday and don't ask me why we're doing stuff like this, but from 9 a.m. to 4 p.m. So the switching it up, we've got to always make it challenging, but I think that's because we have an MOU with Passport, and we're very thankful for that partnership. and they are absolutely giving those for us without any charge to us. We made the space available. They've been a great partner. No one's going to be turned away for inability to pay, but I think Passport may take insurance if people offer it. Most of our locations, when we as the health department are doing, we don't even mess with any of that. You know, people just come in and we're giving the shots. So we've got somewhere that we're giving it basically all the time. And then we're still offering various clinics on Saturdays that are all over those are more targeted clinics where we take the vaccine to people. We're still offering, as you guys probably know, to the homebound, we still provide that service as well. So we're trying to hit them all the way around. Anyone that wants them can get one somewhere. And I think, as both of you have mentioned, with our pharmaceuticals and companies, and somebody was saying, I can't remember what large chain is now offering it that surprised me. In addition to like Walmart, CVS, there was another one I heard today, Costco. I didn't know that Costco was giving. Wow. Costco is giving vaccine. So you can basically, I think you can get a shot anywhere you want it. And now that they made it simpler, this is great. I mean, this is good news. I think before you talk about children, Dr. Bookman, what are you guys hearing about, for those folks that are actually still trying to get a third dose, and for those that have never been vaccinated at all? I think we've had a lot of questions about that. If you don't mind talking about that before we go to the kids and what we're going to hope to do for the kids.
Well, as we said, vaccines are certainly readily available. We've said over and over again, everybody needs to be vaccinated. Whether you had COVID or not, doesn't matter. You still need the vaccine. We got a question from YouTube that says, well, I'm 21. When can I get a booster? And as Dr. Chansome pointed out, you can get a booster.
You can get a booster.
I don't know which shot you had originally. So if it's a J&J, get a second one. If you got one of the messenger RNAs, then get a third one. But you can get a booster, and doesn't matter that you're 21. Even at 21, high risk areas in Oklahoma, people who are exposed, people at high risk, people with underlying disease, basically anyone, go get a booster. So that's pretty simple. As far as people getting their boosters, we've said how readily available it is. We've said people need to get their first shot before they worry about a booster. Get your first shot. Let's make it 100% in Oklahoma County. I'd love for the entire state to follow what Oklahoma County has done. But those shots are easy. They're free. I mean, people aren't paying, so you can't say it's costing me too much, I can't afford it. It's available whether you work or not. There's always a place you can get it. And I'm going to volunteer the Oklahoma City County Health Department as a source that people can call you and find out, where can I go? If I work, 9 to 7, 7 days a week, where can I go at 8 o'clock at night? Or where can I go at 7 in the morning?
And I think it's good, Dr. Bookman, right here to also remind people that, we've developed vaxokc.com. That's just VAXOKC.com. All kinds of information right there with phone numbers of locations to call, where it's offered, when it's offered. And I think that's a very good place to throw that in, because we want people to use that. We've tried to make it available. And, we've had some questions about the people that are 12 to 17 years old. We can't forget that Pfizer is allowing those individuals like have never been vaccinated to go get a shot. Moderna still is stuck with 18 years and older, and so is J&J. But I think it's good to remind people Pfizer is available for 12 to 17-year-olds.
Absolutely. And the other question that I saw is, if I've been fully vaccinated, what is it safe for me to do? And we've said on this show many times, it's safe to be inside with other people who are vaccinated. If you've got family gathering for the holidays and everybody's vaccinated, then it's safe for you to be there. Is it safe to go into your local Walmart or Costco without a mask on? Probably not. We still have a ways to go to get there. But certainly, if you're fully vaccinated, you're less likely to get sick. And if you wear a mask, you're even less likely. So,
And to add to that, Dr. Bookman, even if they're fully vaccinated and they do contract COVID, they're going to have a much, much less severe case of COVID. And
absolutely.
the likelihood of hospitalization is practically non-existent. So,
Yeah. Yeah. So, David, do you have anything to add to the two questions that?
No, I think that's absolutely right. Just about anybody can get it. If you have a 12 to 17-year-old that hasn't been vaccinated yet, certainly do that. I really think we still need to look at. I literally just got off a call a second ago. Kudos to the University of Central Oklahoma, who put together a little panel of some of us to answer the students' questions. Trying to get that cohort vaccinated, a cohort that's probably going to be not as ill if they catch it, but still a very strong body of people who can transmit it. And I have never seen a COVID patient who didn't catch it from somebody. So it behooves all of us, even if you're not one of those people, even if you're not a fat old guy like me. Still behooves us to get the vaccine to try and decrease the community spread and keep your loved ones safe, particularly as we come into those holiday seasons. No one wants to be at the Thanksgiving table with their masks on. We cannot stuff our faces if we do that. So continue to get out there. Now, I think Vax OKC has been a fantastic website. I thought it was a nice alternative when you put it out there. Very easy to navigate. Very easy to get it. But I mean, as more and more places are getting it, I promise you can walk into Walgreens or CVS and probably just get one without making an appointment. More than likely, you can walk into my office and get one without getting an appointment. We do them all the time. And as more and more physicians and providers are getting them, there's going to be more and more interfaces where you can just go talk to your provider. Maybe they have it. But definitely, it's not hard. It doesn't take long, 20 minutes of your day, and then you're done.
Absolutely. I think that's important. So now let's get into the more difficult. What's happened with children? So we've said that Pfizer, 12 to 18, Moderna has now set out their information. And now Pfizer and Moderna have gone to the younger kids, but unfortunately they haven't done it the same way to make it easy on anybody. So Pfizer has said 5 to 11, and they show with one third of the adult dose that you get about 91% effectiveness. Moderna is now using a half the adult dose at 28 days. I believe Pfizer is a 2-dose at 21 days, if I'm not mistaken.
It's the same schedule.
Yeah. And so Moderna is going to be a half dose at 28 days for 6 to 11. They didn't go down to 5. They're at 6 to 11.
There goes the mix and match strategy.
So, it's like people are going to go, wait a minute, I don't understand. So actually it's 6 to 12, not 6 to 11, because they didn't go down to 12 originally. So 6 to 12 with the Moderna, 5 to 11 with Pfizer, a third dose with a third the strength with Pfizer, a half the strength with Moderna. Both are showing about 91%, give or take. So both very effective. We think that by the second week of November, these vaccines are going to be out for the kids. Take it from there. David, what are you recommending to, I don't know whether you see children, but at least to the parents. I'm an internist, so I'm trained in adult medicine. But that being said, we have been vaccinating 12 to 17-year-olds pretty regularly. Been out to several schools around Oklahoma City and Edmond and Moore and places like that we have gone to that wanted to get vaccines for their constituents, for their students. So we have done a lot of that. I think it's going to present more challenges. I think as we go down in age, age is probably inversely correlated with the percentage of people in that age group who have the vaccination. And I think you'll see the same thing.
I
Mhm.
think that whereas over the age of 65, we're doing great, and we have probably 80-90% in Oklahoma County. When we get down to the 5 to 11-year-olds, I think you're going to see a lot less uptake. But there are going to be some people who are very enthusiastic about it. We've already been
Mhm.
getting great communications from OCCHD about their distribution plans. It'll probably come, the Pfizer will probably come in a different package, in a different color bottle, I think. Isn't that right, Dr.
Mhm.
McGowan? So, I mean,
Yeah.
it's not like I got to try and get 20 doses out of a vial that
Right.
is only giving me 6 adult doses or 7 adult doses. So there'll be some logistic stuff in there. I think, I don't think it's going to come frozen, which makes it a little bit different. But anyway, bottom line is, I think there will be uptake. How exactly we're going to do that, you can't, it's not as easy to do a megapod with 5 to 11-year-olds. That sounds to me like the third circle of hell.
Mhm.
1,000 5 to 11-year-olds all simultaneously getting shots. Thank you. No. I'm not volunteering for that without a
Sounds like a disaster.
really big earmuffs. So I think logistically it'll be interesting. I suspect, having spoken with many pediatricians and family doctors and general practitioners and healthcare practitioners, I think they're all very excited to be able to provide that in the clinic. And I think that there will be some uptake. I would guess at the beginning, maybe 20 to 25% of parents will be looking for it. And I'm sure that they've already kind of got their ear to the ground. I don't know. Do you know, Dr. McGaw? I mean, at some of those OCCHD places where they've been doing vaccines, do you think they're going to do the kiddos like that too?
Well, I think what we're going to do, just like you mentioned earlier, some days you're begging people to take the 30th dose or
Mhm.
whatever
Mhm.
for a vial. And I think we kind of are looking forward to seeing how that really does turn out. Like
Mhm.
what are people going to do? We're prepared for whatever that may be the situation. But we're thinking we will see them in our clinics the same way we do every year for whether it's flu or just
Right.
back to school immunizations. And I'm sure we'll put together several special clinics. What I what I have been advised to tell you, we are, FDA meets tomorrow to discuss Pfizer for the 5 to 11-year-olds. I guess you guys know that. The advisory panel of physicians, much like yourselves and others, will get together and review the data again. And then next week, it goes before the ACIP, which is CDC's advisory committee. As you guys know, a lot of people don't know, but we already have the emergency authorization. Use authorization is already updated. So
Mhm.
we're really waiting. It's kind of backward. We're waiting on approval that
Right.
we really don't need.
Right.
So that is one of the pieces. But I think we anticipate, with it being so readily available, people will be going to their pediatricians, their family practice docs, and hopefully we'll see a lot of them here, and we'll get to treat that much the way we treat any of the other things. I think we will try. Today we had a little pod in addition to the routine clinic. We had a pod at our North location today, and it was fairly well attended. I think it'll be the same thing. We will offer group opportunities for people to come in and just get in the line and get that done. But there's, as you mentioned, there'll be some extra challenges with children and the ages of the children. So we'll probably separate some of that out. But we have all kinds of things planned for that. And really, we have plenty of vaccine, and we're just hoping that people will take advantage of it more than how we're going to do it. We're concerned that there will be some hesitancy on some parents' part. And I would like to ask the two of you, because you know much more about many of these things than I do. But with some of the information that's come out about, the risk of a child actually getting it and all those kinds of things, I think people need to remember it's also the child's ability to transmit the disease. And we're still wanting to protect maybe a child that is immunocompromised, that child is around, or a grandparent that maybe has a number of comorbidities. And so I think all of that is important when we're trying to get all of the children to be vaccinated.
Yeah, I think that transmissibility from children to elderly adults, as David said, with the holidays coming up, I think that's really the crux of the matter. We've said over and over again over the past year and a half, it's not just about protecting yourself, it's about protecting others. And with children, we've lost over 700 children to COVID deaths this last year. That's 700 deaths that just shouldn't happen. And so, yes, we want to prevent the child from getting really sick. And we know that kids now are making up almost 25%, 20 to 25% of admissions. So the kids do get sick, not as sick as the older adults. Death isn't as high as in older adults, but they transmit it to the older adults. So getting these vaccinations is important for everyone. I think that's the bottom line that needs to be taken out of this. If you can get a shot, get the shot, whether it's a child, whether it's an older adult, get your shot and get vaccinated. Get us out of this pandemic, and that's the only way it's going to happen.
I agree 100% with all of that. I think that yes, we've only lost 700 children, but how many orphans have we made? Yeah. I mean, it's also about that, and that to me, is just as scary long term for so many different reasons. But so bottom line is herd immunity is herd immunity. That means the whole herd, not just the herd that's 18 and over. It's going to be safe. It's going to be effective. I just don't want to be anywhere near a megapod 5 to 11-year-old.
I can understand.
I believe I'll be able to find it really, really easily if my window.
Well, let's bring up the least pod that you want to be in. That we need to let everybody know that Moderna and Pfizer are both currently under study for 6 months and older. So it'd be 6 months to that 5 or 6 years old. That's really a pod you don't want to have 1,000 of them in.
No, for sure.
But so look for that towards the end of this next year, towards the end of 2022. Hopefully we can get everybody vaccinated.
They've done a great job with those studies. So, I mean, I think that they're really looking hard. If you've got kiddos that are in that age group, it might be something worth calling either the Lynn Institute or I believe OMRF also has a study going on. But I'm sorry, Dr. McGott, I didn't mean to interrupt.
No, that's fine. I was just going to say that's a very valid point about maybe a clinic or a pod that you don't want to be a part of. But, that's a thing that pediatricians in the public health department, we've been giving shots to infants for years and years and years. And so I think we look forward to being able to provide that service to, there are a lot of young parents that are really afraid to take their children out to places,
Yes.
They don't. And so I think it will free them up and they're looking forward to that opportunity to be able to get that. So
that's a great point.
Yeah. No, I can tell you my kids, I have 3 grandchildren, all under the age of 4. So none of them are able to be vaccinated at this point. And my kids are very scared to even go to a restaurant with them, to go anywhere with them. And yet they can't go without them. So, it is a problem. And I look forward to the vaccines for children and for the really young infants. So, do we have any other questions that we need to answer right now, Scott?
I do.
I was going to ask if Scott.
Go ahead.
Oh, yeah.
Patrick.
Yeah, I was going to ask if Scott could put up, it's what we've already discussed, but our group, Hallie Reeves, she was with OU previously as one of their vice presidents over rural health. And we've had the good fortune to recruit her, and she's doing some work for us these days. And she put together, I think it's 3 different slides, Scott. And
I have vaccine, booster, and additional dose.
Yeah, just throw up any of those. Because Dr. Chancelman and Dr. Bookman have already been through all of this. And so these are questions that she designed this based on what we're getting all the time. So are you eligible for a COVID vaccination? And so individuals who are not yet vaccinated and are 18 years or older, then yes, they can get any of those. And if they're 12 to 17, which we already talked about, then they would be eligible for Pfizer. So that's pretty simple, cut and dry. And we were trying to put it together in such a way that everybody could read it, easily understand it. What's the next one? So then we have this one where everybody keeps talking about the additional dose, or what we were calling third dosing, for people that have already met all the criteria to be fully, what we had been calling fully vaccinated. So again, people that are 12 or older who are moderately to severely immunosuppressed or immunocompromised conditions, and they have received Pfizer series, then they're eligible for an additional dose. or a third dose of Pfizer. And that has to be 28 days after their earlier one. The same thing goes for 18-year-olds and older, and that's with Moderna. And we kind of had covered that as well. So Scott, then there's one more. That's the one that this hits all of the areas that Dr. Chensom did a great job walking us through. So folks who were vaccinated at least 6 months ago, if they're 65 and older, then they are eligible for any of those vaccines. If they're 18 and older and they are in a long-term care setting, have underlying medical conditions, work in high-risk settings, or live in high-risk settings, and we determined that everyone in Oklahoma, because of our transmission rate still being in the red and so high, they qualify, basically anyone 18 and older. And then lastly was the individuals who were vaccinated at least 2 months ago, and they're 18 and they have received a Johnson & Johnson, and I should say 18 and older, then they're eligible for any of those vaccines as well. And so this was just something I not only wanted to put out there, but wanted feedback from Dr. Bookman and Dr. Chansom about what they thought about these, trying to make it really, really simple when we put that out for communication. And if you guys had any feedback on those.
I think those are perfect. I'm stealing them. Can we steal them?
Yay.
Yeah, I think that's excellent.
Excellent.
The whole point is to make this simple.
Simple.
You know, if you listen to the national news and read, you just get more and more confused. We need to make it basic and simple, and you've done that on those slides. So perfect.
You have to have really good graphics department to do. For example, you know, when you do something like this, you gotta have really, really good graphics
That person is
department.
still looking for
That's
the top.
amazing. That's amazing. That was a good picture, Dr. Chansom.
Oh my goodness. That was when I still wore stuff besides scrubs.
If you pay him, he'll sign an autograph.
Occasionally, we invent words around here, like for Dr. Armitage. We, you know, we do this. Pictures worth 1,000 words. Hey, you ask Dr. McGough. I told him I said 15 minutes, and I lie every time, right, Patrick? I mean, every
It's
single
all
time.
right.
You know,
I want
absolutely.
to ask you for permission since Dr. Chansom brought it up. So I want to start wearing scrubs all day. I mean, I'll pull out my nurse practitioner, slap it on there,
It's so
and
good.
I
dude.
want to wear my scrubs every day, all day. You think the board would let me do that?
I think you should definitely stack the board with people who will. That should be your litmus test.
I already got one.
I know.
Yeah.
I know Scott would
We
be
got
there.
Yeah. So wait, you asked about some questions. I had a couple of three. Flu shots. Can we get flu shots, Oklahoma City County Health Department yet?
Yes, you can. And unfortunately, our problem is getting all the right types of vaccine. You know, we have a vaccine for children, we have 317 vaccine, and we have regular adult vaccine that we purchase from places, and even some that we purchase for children. And unfortunately, we are in limited supply of flu vaccine. So we have more COVID vaccine than we have flu, but lots of places already have flu vaccine readily available. But what we will continue to give it until we've given out all that we have. I'm trying to see someone today they were telling me exactly what we did and didn't have, but I don't see it now. But we have basically, I think we're still working with 317. So we have vaccine for people that have no ability to pay, no issue. Please come get your flu vaccine, and then I know it's readily available everywhere. I'm hearing it at Walmart, I guess Costco, everywhere you can get flu. So please do that as well. I think it's important right now to talk about the fact there's no contraindication to getting them both at the same time. There's no contraindication if you want to get a COVID vaccine, wait 2 weeks and then get your flu shot, whatever, melt your butter. Please feel free to do it. Just get both.
Yeah, very important. And also for the older patients, get the quadrivalent, the high dose
Yes. Good
vaccine.
point.
By the way, you mentioned 700. We lost 700 babies in this country. So I can only think of one picture that I want to throw up. That's mine. Okay. So when I hear that, you know, what people talk about, well, it's just the numbers are really low. Think about 700 of those. Okay. As you said, Dr. Chan, how many orphans, but that precious life right there is That's my grandbaby, by the way. That's Atticus.
One is too many.
Yeah. I was doing. Hey, bye, Addie. See you later. So, numbers. There's a life behind every number, right, Dr. Chancellor?
The most important number is 1. So we just treat one patient at a time, give one vaccine at a time, save one life at a time. The most important number to know is 1, especially if it's this one.
Yeah, I would like to tell people the most selfish thing you can do is get a COVID vaccine, and the best thing you can do for others is get a COVID vaccine. I mean, there's no way to lose.
That's right.
So,
Absolutely
right.
please feel free to take care of
Absolutely.
yourself.
I'm using that one too. I'm still in that one too. That's
Yeah.
Or we should let Dr. McGough go. He's
Wow.
big. Can you go
Before
home
he
now?
goes, I have one other that may involve, and this isn't rehearsed. This is what live TV does. But the CDC Advisory Council came out with a new, or an updated, I'll say, pneumococcal vaccine recommendation.
Mm-hmm.
I don't know if that involves Oklahoma City County. I don't know if you give the Prevnar
We do.
vaccine. So, what they're saying is over the 60, greater than or equal to 65 years of age, Prevnar 20, or if you get the PC 15, then you've got to get a few weeks later, get the Pneumovax. So you got to get 2 different ones.
Right.
And I don't give those types of vaccines, but it's important that people know recommendations have come out, and it's important for people to get those pneumococcal vaccines. Vaccines are important. For 19 to 64, they're saying if you have underlying medical conditions or risk factors such as diabetes, congestive heart failure, cardiac disease, COPD, etc. But everything's not COVID. We still have flu vaccine. We still have the pneumococcal vaccine. There are other vaccines that are very important, Shingrix, etc. But, we need to get these vaccines into people. So,
I agree. Thank you for bringing that up too, Dr. Bookman. And before Scott pushes me off the show, I just want to say I really appreciate Scott and both of you and all of you guys that are usually on this show for correcting misinformation, making certain that we get good information out to the public. And we appreciate your support to your local health department. It has meant the world to us, and we really, really do appreciate it. And yes, so we need to remember the pneumococcal vaccines are important, the flu vaccine, and the COVID vaccine. And there's a lot going on in the health department right now besides just COVID. It has been the number one thing that's taking up most of our time and effort, but for good reason. As we talked about, one life lost is too many lives lost. And so again, just thank you all very much for the great work that you're doing on an ongoing basis. I appreciate all of you.
thank you for your great work.
Thank you, Dr. McGough.
Dr. McGough, thanks very much. We'll see you again soon. And tell everybody rest up, just un poquito, okay? I know everybody's really tired, but our hats off to you, Phil May, Tubby, Kay Hewlin, the whole team over there. But like I said, you got a standing ovation last week for all the
Well, and the team, it's an amazing team and couldn't have done any of it without every one of them. So thank you for recognizing them too, Scott. I appreciate it.
Thank you.
I'll talk to you guys later.
Take care.
Bye-bye.
Bye-bye now. And we also want to go ahead and let you know it's Oklahoma City County tonight. Dr. Bruce Dart with Tulsa County Health Department. He's our guest next Monday, so we'll have plenty of time with him. I do have one. I'm practicing medicine here, doctors. So they were talking about, Dr. Bookman, you mentioned the Shingrix. So I saw firsthand this weekend when you get your flu shot and Shingrix number 2 at the same time. Whoa. She's not happy. Okay, especially that first 24 hours. Okay, so Candace Mitchell was like, bam, like a truck hit her. One arm Shingrix, one arm flu. Dr. Chancellor, Dr. Bookman.
Getting many vaccines can be difficult. It might have just been one of them. It might not have been the fact that she got all of them together, but who knows? It's hard to say. But hey, good for her for getting vaccinated. Sometimes you got to walk through the fire a little bit to get to the other side. I know she,
We were on a vacation one time to Disney World when she had a shingles outbreak. Okay, it was awful, and she was pushing through for the kids, but that was awful. So
Ask her this: Was the vaccines that she got better or worse than when she had shingles?
Oh, it was much easier. And she was
Yeah.
like, "Yay!"
Yeah.
Yeah, she'd go through it all again. So,
Well, David, do you have anything more on COVID, on any of the news that's come out?
No, not really. I mean, feel like we saw a little bit more of a, we were coming on a nice trajectory. This week it's kind of flattened out a little bit. I feel like, still seeing some scary cases out there. Still plenty of COVID going on. You got to remember the whole state is still in the red, except for like maybe 3 counties. So it's still an issue that we have to worry about. We can't let our foot off the gas yet. There's a question on here from Melissa. Do I need a booster? I've had COVID, had the infusion and 2 COVID shots. Seems a bit excessive to get more. Melissa, you bring up a great point. You've had COVID. You've had the monoclonal infusion. You can't get a shot within 90 days of a monoclonal infusion. You can rest assured that having had the 2 vaccines and having had COVID is pretty good protection. You would certainly not be ineligible for the booster if you went to get it. I don't think it would hurt anything, but just know that with the 2 shots and natural disease, you got, I wouldn't say bulletproof, but I'd say pretty strong immunity there. A lot of these things we won't know for a long time. We still have to remember how early all of this information is coming out. How early we are still in terms of science, the way science works. We're still collecting stuff that will take years to be able to assimilate all this data and figure out what the best immunity strategy is. All of this mixing and matching that we talked about earlier, and 2 doses, and if you get your 3rd dose, if you get something different, all of this stuff will become clear one day. It's going to be a while though. So.
Yeah, and let me add, there was a study done several months ago, and I think it was an Israeli study, but it looked at people who had COVID and got a single booster shot, and they had tremendous spike. I think it was 5 times spike in their antibody production, if that's what we're going to look at. And I'm not saying
there was a really good article. It was a fast article. It was in an MMWR. They looked at the Kentucky, and they took people who everybody had COVID, the disease, and then your risk of reacquiring COVID if you did not get a vaccination, if you only had partial vaccination, or if you had a full series. And the people who had COVID who did not get vaccinated were 2.5 times more likely than people who'd been fully vaccinated to get COVID again. So, I mean, it's not that now, Melissa's different because she's had the vaccine, and that's awesome. What do we know about the boosters in that situation? We don't know anything yet, is the bottom line. But certainly if you've had COVID, although natural immunity is exciting and does seem to have some protection, it is still strongly recommended that you get a vaccine. And if you want to go to a Thunder game, you're going to need it anyway. So there you go.
Yeah, that's an important point, though, that we sort of glossed over. It's important that people who have been vaccinated laminate your card, make a copy of it, keep it on your phone, do something, because we had some friends who went to the Civic Center to see a play recently without their card. No go. Mm-hmm. You don't get in. You have to show the vaccine that you've been vaccinated or that you've been tested within 72 hours, or you don't get into the Civic Center. You don't get in, as I understand it, to the Thunder game. There's going to be more and more venues. So make a copy. If you've been vaccinated, keep it with you.
Or sleep at the wheel Friday night at King's Ballroom.
Yeah.
Oh, right.
Yeah. Not coming in, dudes.
Yeah.
It's interesting. By the way, I don't know if you guys got to see. I should have loaded up Hot Seat this weekend, but my guest Saturday was Chad Warmington, the CEO of the Chamber of Commerce, State Chamber of Commerce, and I mean he really took on DeSantis and Abbott over these mandates against vaccine mandates, and he lauded the governor. Said the governor says not going to do that. He said businesses, we need to practice what we need to do. We don't need government coming along and telling us what we can do. And he called out some members of the GOP. I mean, if you haven't seen it, go to news9.com/YourVoteCounts. You can see that Chad Warmington, he was strong as you can be. And it's really, I mean, he really was taking on that extreme right of the Republican Party, going, stay out of business, stay out of our way.
Yeah,
And
good
it
for
was
him.
really strong.
Good for him.
That was what was said at the beginning. We're going to let local people make local decisions for what's best for them. I mean, when all of a sudden you're listening to the 2 or 3% of people who are clamoring about vaccine mandates, I mean, I got news for you. Most people are not angry about it. The vast majority of people, greater than 90% of people, understand why it's a necessary thing. It's not like we're half and half. So, yeah, I couldn't agree more. But, I mean, that Florida governor, I mean, my goodness. Do you see the Surgeon General he appointed refused to wear a mask in a meeting with a cancer survivor the other day? I mean, just appointing a clown to a very important position. It's
the state to our south is no better. And the governor is no better.
I don't know why he's doing this.
I'll tell you why.
Yeah,
that's on our political show. We'll talk about that sometime.
Yeah, we'll talk about that later.
The politics and medicine together, it was a really, really messy marriage. And, and a lot of people died because of it. A lot of people died because of it. It's just bad. Anyway, so that's Chad Warmington's hot seat on News 9. Your vote counts. I can't even remember. Oh, yeah, www.news9.com/your vote counts. So you can see that there. Really, really appreciate you guys. Every time we have one of the guys that decide not to be with us, we have great shows. Have you ever noticed that? How that works out?
You saying 4 is too many?
I'm just saying that they missed the show, and then the great things happen, like fourth quarter comebacks, and so.
Yeah.
Well, I'm going to be gone next week, so I'm going to appoint David as the go-to guy.
Are you gone next week?
I'm gone next week.
Okay.
Yeah, we're going out to see our grandkids. So,
Very nice. Very nice.
It's that time of year. You got to see your.
I will still be in a sugar coma from Halloween, probably, but I'll try and make it on the show.
Don't have to worry about any World Series traffic in Frisco or Oakland next week. So that's.
My Braves made it in, baby. My Braves. I lived here. I was in Atlanta from 89 to 93, which was when they got good. In 89, we would buy a $5 ticket and sit behind home plate. I mean, it was unbelievable. And then in the 90s, of course, with Bobby Cox and that sick pitching to us, I was really into the game the other night. I thought that was a great series. Dodgers Braves was a fantastic series.
Braves in 6.
I don't know how they'll do against Houston, but
Braves in 6. That's how this is going to go.
All right, we'll see. We'll see. New Orleans, my Saints aren't doing so good right now, so we need to.
One more. Well, my team's got one more, and it was to play in the Saints. That was it. So, but by the way, I don't know if you guys saw that. So the Packers have the Cardinals Thursday night, and Devontae Adams out with COVID.
Really? I didn't see that.
Yeah.
All I can say is go Cardinals. Kyler Murray's awesome.
Unbelievable. Kyler
Murray is
the MVP
awesome.
if he's not careful.
Yeah.
I don't know who Aaron's going to throw to. Defensive coach is out with COVID again, fully vaccinated. But this is what's happening. I mean, it's the real deal. And you guys called it way back there. You said as the population keeps on getting vaccinated, we're going to see the breakthrough cases.
Yeah.
I don't know if he's talking about that anymore, but it's happening once in a while.
But what's important to remember is that only Devontae Adams is out. They don't have to quarantine and vaccinate it, or they don't have to, not all those other people have to get out like it was last season, right? And one guy got it, then suddenly your whole receiving core is down because they all practice together all the time. They all sit in the meeting room together. They're getting better at this. They're getting really good at it, actually. But that's probably going to keep on happening, for now on. Probably you're going to have people off here and there. The question is, will we continue to isolate after everybody's vaccinated? I don't know.
So the way the NFL works is he has to have 2 PCR tests 24 hours apart. Yeah. And it would probably happen if they were playing on Sunday. The problem is they're playing Thursday night.
It's a Thursday game. Yeah.
So it happens. But kudos to NFL, kudos to NBA. And by the way, it was such a great thing when you saw what the Thunder did. We had Dan Mahoney from the Thunder on. It's been about a month ago, and they said, you got to come in. Now, you know that some people are cheating, right?
Sure.
They're going through the line and they're cheating. But the fact is the organization took the personal responsibility of being a good corporate citizen.
Yes.
And the government didn't tell them you can't exercise your personal responsibility. So kudos to Governor Stitt and the people who said, we're just not going to do that in Oklahoma like they've done in Florida and in Texas, which O-State and OU beat Texas, all Texas teams. So we win. Okay, anything else, doctors?
I think that's it for this week.
All right,
you guys have a great Halloween.
And we'll miss you, Dr. Bookman. Is that 1 or 2 weeks?
What's that?
Just 1 week.
Just 1 week? Okay.
Yeah,
We'll
I'm
be
gonna
back.
go out and trick or treat with the grandsons.
That'll be fun. So I think it's Fab 3 next week. Dr. Chanson, Dr. Armitage, and Dr. Sub will be back.
We'll talk
Yes,
about
sir.
Larry the whole time.
Yeah,
will.
that's okay.
All right. Thanks to our audience. Thanks for the questions. Appreciate all the questions. COVID-19, we got your question. COVID-19 in Oklahoma, we got your first question up. And appreciate you. By the way, if you're not following COVID-19 in Oklahoma on Twitter, then you're not up to the latest information. I hope you'll do that. Meantime, Scott Mitchell saying good night. Be careful. See you next week.